WWJ News Time 1:14. Pediatricians are seeing an increase in another virus in their young patients. WWJ health reporter Dr. Deanna Lites with an in-depth look.
It's called RSV, a respiratory virus that doctors say usually doesn't show up until late fall and winter, but it's sidelining kids now. Dr. Kevin Dazy is a pediatrician at Children's Hospital of Michigan.
Yeah, we are actually seeing a surprising early spike of RSV cases in the emergency department. Typically, we start to see these cases rise earlier, as early as September, but we have seen this begin within the past month and kind of continue to climb.
Any reason why it would start so much sooner?
I don't think that anybody really has an answer to that. I think everybody kind of has their suspicions. I don't know if it's because, kids are socializing more now. Kids are back in daycare. Kids are around each other more. But honestly, it's definitely kind of a unique thing that we're seeing in the hospitals.
Are some of these kids having to be hospitalized with it, or are most discharged from the ER?
So it really depends. RSV causes an infection in the lungs. It's a virus. It mostly affects kids under the age of 2. And the really young ones are the ones that we see get hospitalized with this, and other kids that have underlying lung issues in particular. But certainly, kids of all ages, particularly in the toddler age less than 2, that we do see hospitalized.
Are you worried about COVID too? Like, how do you know if it's COVID or RSV, or do you have to test for both, or what do you do?
So the way that we have it, and probably a lot of emergency departments around the state and the country, do a test that includes RSV and COVID together. Now, sometimes they can present really similarly. Sometimes it's just a stuffy nose, and that's all we're seeing to begin with, and it's hard to differentiate which one it is.
For most of these young kids, it'll be like self-limiting. Their parents will just treat the symptoms and they'll get better. But is there anything that you want to tell parents, or something they should be looking out for?
Definitely. I mean, we've definitely seen a lot of these outbreaks kind of starting in daycares and in, congregate settings where kids are around other kids. Kids oftentimes will start with maybe a fever, sometimes a low-grade fever, sometimes they'll get a high fever, and then maybe a little bit of a runny nose. The things to really look for is their breathing and their eating. If they're not able to drink or hold down any liquids, then they, certainly could be getting dehydrated. If their breathing looks fast or they look like they're in any distress, then I certainly think it's time to call the pediatrician or come to the emergency department. Yeah, I think differentiating them sometimes can be difficult. And this is kind of what we deal with every winter, right, or every fall. Once kids start to spend more time inside and are closer to each other, we start to see what we call a viral season. So in addition to RSV, now we have COVID, influenza we haven't seen much of yet, but certainly that is something that we might see come in the future as well. Other viruses are also circulating right now in the community as well.
Dr. Deanna Lites, WWJ Newsradio 950.